I'm Samuel Uribe, and my topic was non-insulin dependent diabetes, or also known as type 2 diabetes. So, for this condition, it is a chronic disease that affects the way your body metabolizes sugar. It is a form of diabetes that is caused by insulin resistance that leads to high blood sugar. It occurs when insulin is being produced normally in the pancreas, but the body is still unable to move glucose into the cells for fuel. This leads to less insulin production, which in turn leads too much glucose in the blood. This disease is a major health concern as 32.6 million Americans were determined to have type 2 diabetes in a research conducted in 2018. This is roughly about 10% of the population. This condition used to be considered adult onset diabetes due to a lot of adults over the age of 45 having this disease, but this was changed as many more young adults and children were being diagnosed with this condition. Some risk factors that put you at risk for type 2 diabetes are being overweight or obese, being over the age of 45, having a family history of diabetes, having high blood pressure, having a history of heart disease, and stroke. All these are major risk factors for this disease. Some signs and symptoms to watch out for are increased thirst and urination, increased hunger, fatigue, blurred vision, numbness or tingling in the feet or hands, and unexplained weight loss. Some diagnostic tests that are used to diagnose type 2 diabetes are the fasting plasma glucose test, which measures a person's blood sugar level after not eating anything for at least 8 hours. So a normal test result would be under 100 milligrams per deciliter. Anything over that would be considered diabetes. Another test used would be the A1C test. It is a blood test that provides a person's average level of blood glucose over the past 2 or 3 months. This test is not accurate with anemia in a person's blood. And then another test used is the random plasma glucose test. This measures a person's blood sugar level at any random point, regardless if they fasted or not. And then how to treat type 2 diabetes is basically keeping your diabetic ABCs in check, which A stands for the A1C test, the B stands for blood pressure, the C stands for cholesterol, and the S stands for stop smoking. So making sure, consulting with your doctors about having goals as to what you want your values to be for these important ABCs is important to help prevent long-term effects of diabetes. Improving your diet is also important as you want to develop a meal plan that includes foods that are low in calories, saturated fat, trans fat, sugar, and salt. Drinking more water is also beneficial. Also, you want to be more physically active and aim for 30 minutes of physical activity a day, whether it's walking, running, biking, whichever type of physical activity would be beneficial. If the disease doesn't improve with lifestyle changes, medication and insulin injections may be used to help to treat the disease. So how to prevent type 2 diabetes? You want to manage your weight, exercise regularly, eat a balanced, healthy diet, limit alcohol intake, stop smoking, and see your doctor for regular checkups to check your risk for diabetes. Thank you.